Hello and welcome back to Pro-gnosis, aka Professional Knowledge, the series of lectures designed for medical students, postgraduates, and junior doctors. My name is Dr. Stepan Karabinyash. I am a physician specializing in infectious diseases and pediatrics. Welcome to the second episode, where we shall continue with the topic of the art of collecting the anamnesis. First of all, what is anamnesis and why is it so important to make sure that you're precise at its collection? Another word for anamnesis from Greek means open or memory, or more common term, history. Basically, it's the information acquired from the patient by a physician. It includes information about patient's life, childhood, family diseases, details about current disease, allergies, substance abuse, including alcohol consumption and smoking, chronic diseases and conditions, recent traveling, exposure to infected individuals. All of this is included in anamnesis. Remember, the more detailed is the information, the closer you are to make the proper assumption of the right diagnosis and rule out the wrong guesses. Last time we discussed the essential terms related to diagnosis. Now let's discuss the professional language. When a patient approaches you at a medical facility, you should be capable to interpret layman's terms or everyday language to professional medical language. If you happen to examine the patient with a complaint, we doctors translate it into terms that are suitable for our profession and will be understood worldwide. For example, stomach pain will sound as gastralgia or gastrodynia. Believe me or not, no matter where you are, once you describe the symptoms in professional language, you should expect that you will be understood in most countries of the world, be it Europe, Americas, or Asia. The link to the list of such terms will be published in the description to this video. Now let's talk about how does it help you in your profession. Well, first of all, the proper communication with your patient allows you to reveal the key features of the disease they might be suffering from, and thus you can build a proper strategy to diagnose and treat them. So now let's see, how do those words participate in leading us doctors towards diagnosis? First of all, good listening skills help you to acquire as much information as possible. And even though you might be in the circumstances when a patient shares with you a little too much than you expect, believe me or not, that conversation can be healing itself. Here are a few essential skills to have a successful doctor-patient communication. Be compassionate and empathetic, but keep the boundaries. Develop trust, but be honest. Don't give promises and false expectations. Be supportive and use rapport. It keeps to develop a successful bond. Give clear and honest explanation. Patient must be aware of everything of his or her health. And remember, you must always obtain a consent for all procedures. Once you obtained all the complaints, you interpret them into signs and symptoms. So what's the difference between signs versus symptoms? Signs mainly refer to visible manifestations of the disease, unlike symptoms might require instrumental or laboratory examination. A combination of signs and symptoms can be associated with a specific disorder or a disease and may be grouped into syndromes. This way, it's easier to be more specific with a suspected disease. Let's see an example here. A patient complains on high fever, stomach pain, vomiting, and watery diarrhea. As a physician, you interpret these terms pyrexia, gastrodynia, emesis, and diarrhea. Group up into gastroenteritis as a syndrome. Now, as an infectious diseases specialist, you go through the anamnesis details: age, consumed food, traveling history, etc. Obtain some instrumental and laboratory results and come up with a clinical diagnosis. Later in this course, we will learn how to distinguish, how to focus on the red flags of each disease in particular, and to rule out the unnecessary information. Now let's discuss the classification of communicable or infectious diseases. There are a few ways to classify infectious diseases: by the type of the pathogen, for example, viral, bacterial, protozoal, fungal, and parasitic. Often, infectious diseases are also classified by the mode of transmission of infectious agent. So, the modes of direct transmission, when infective form of agent transferred directly from reservoir or a host. Direct contact is due to direct physical contact between the skin or mucosa of an infected person and a susceptible individual. Direct spread of droplets, this time of transmission, happens during sneezing, coughing, or even breathing out of agent-containing droplets that are too large to remain airborne over a large distance or for a prolonged period of time. Direct exposure to an infectious agent in an environment. Diseases that spread by direct contact transmission in close proximity of infected and susceptible individuals. Bites. Animal bites that may transmit some infectious agents, which are directly transferred through an altered skin. Transplacental, perinatal, also known as congenital or vertical, pre, post, and perinatal transmissions occurs during pregnancy, delivery, or breastfeeding, respectively. Modes of indirect transmission: infective form of pathogen transferred directly from reservoir or previously infected host. There are three main categories of indirect transmission: biological, mechanical, and environmental. Biological, when there is a biological vector or intermediate host. Mechanical, when there is a mechanical vector or a vehicle. And finally, environmental, most often airborne. Hosts, vectors, and vehicles involved in the life cycle of an infectious agent transmitted indirectly. Let's have a closer look in some of the terms. Definitive host: it's a host in which a parasite reproduces sexually and causes the disease. Reservoir host: it's a host that helps to sustain an infectious pathogen and may serve as a potential source of infection. However, reservoir host will not suffer from the infection. Intermediate host: it's a host in which larval or intermediate stages of a pathogen develop but does not reproduce sexually. Such hosts does not directly transfer a pathogen to the definitive host. Dead-end host: type of a host from which pathogen cannot be transmitted to another susceptible host. Vector describes a living organism which is involved in the indirect transmission of an infectious agent from a reservoir or infected host to a susceptible host. Biological vector: such vector in which a microorganism must develop or multiply before it can be transmitted to a susceptible host. Mechanical vector: a vector that transmits a pathogen from one host to another, but is not essential to the life cycle of the microorganism. Vehicles: artificial objects that serve as an intermediate in the indirect transmission of the pathogen from reservoir or infected host to a susceptible host. These usually include food, water, and fomites such as doorknobs, surgical instruments, or used needles. Biological transmission: it is such that occurs when multiplication or development of a pathogen within a vector is required for the agent to become infectious to humans. Extrinsic incubation period: it is the time that is necessary for the pathogen to multiply and develop within the vector to become infectious. Intrinsic incubation period, which is basically the time required for an exposed human host to become infectious. Mechanical transmission, such that does not require pathogen multiplication or development within a living organism. It may occur when an infectious agent is physically transferred by a living vector, mechanical vector, or an object, a vehicle, to a susceptible host. Environmental or airborne transmission requires aerosolized suspensions of residual content like evaporated aerosol droplets or particles containing the agent that can be transported over the time and long distance and still remain infective. We should also mention that sometimes diseases are classified by its origin or by what was the vector. For example, zoonosis, the diseases that can be transmitted from animals to humans, anthropognosis, diseases that can be transmitted from humans to animals, sometimes also called reverse zoonosis. Sapronosis, infectious diseases caused by the pathogenic microorganisms that usually inhabit aquatic ecosystems and/or soil rather than a living host. If you enjoyed this video, give it a thumbs up. And remember to subscribe to the channel to stay updated about new upcoming episodes. I would appreciate your opinion and questions, so feel free to leave your comments below.